Dr. Stephen Campbell.
Thank you. This is a wonderful meeting, and it's great to be in New York. Recovery of renal function after radical nephrectomy and partial nephrectomy. Here's our data from the Cleveland Clinic showing recovery of global function after radical nephrectomy.
Dr. Campbell is a professor of surgery at the Cleveland Clinic, the residency director.
I think we should consider a renal scan selectively to predict recovery when it might be clinically relevant.
His residency at the Cleveland Clinic, and then came to New York City to do his oncology fellowship.
These are really the key factors to determine the ultimate renal function. Data from the Cleveland Clinic, if you save 80% of the mass and you get 80% of the function, you've recovered 100%.
And now he's one of our foremost academicians on renal cell cancer.
We had to say maybe we didn't have enough warm ischemia times. Maybe we didn't have enough extended warm ischemia. Maybe we'll see a true impact of ischemia.
What is the ideal way to do a partial nephrectomy?
We could argue, you know, sometimes they'll drift 1 or 2%, but usually that's it.
He, I believe, did his training at the University of Chicago for his MD PhD.
So our refined perspective on ischemia, is there a cohort that does not recover as well from ischemia? So then we looked at comorbidities. The loss of vascularized parenchyma, that's the key factor. A few thoughts. First, if you have a normal contralateral kidney, it probably doesn't matter.
Thank you, Dr. Campbell. That was actually an excellent review and really insightful.
I think you're right. This idea that we just look at how many people cross thresholds can be very misleading.
You've done phenomenal amount of piece of work in the past 5 years.
Really, you need to put all these factors together when we calculate these data.
I agree 100%. It's good to start learning more about it to see where our attention needs to be. We also need to recognize that it's probably a lot more complex than we quite appreciate.
Compliments to you for your leadership.
Great.
Thank you very much.
Thank you.